my name is Erin McGrath. This is my individual addiction presentation for SHUSER 437, Co-Occurring Disorders, Cal State Fullerton, Spring 2026. So what do we know about pseudoephedrine? Pseudoephedrine has no individual DSM diagnosis. It is a central nervous stimulant with similar effects to other stimulants such as cocaine or methamphetamines. The addiction starts slowly. Severe use becomes a daily habit. It cannot easily be untaken, and the recommended span for it is no more than 7 days. It can cause paranoia, mental health issues, anxiety, and depression. What is the use? The motivations people have are increased energy, increased focus, and feelings of euphoria. The perceived benefits would be increased socialization, better job performance, and appetite reduction or weight loss. The perceived psychological benefits are confidence, perceived increase in physical and intellectual performances. How does pseudoephedrine work? It has recommended and approved dosages. 12 years to an adult is 60 milligrams every 4 to 6 hours. 6 to 12 years old is 30 milligrams every 4 to 6 hours. 4 to 6 years old is 15 milligrams every 4 to 6 hours. It is not recommended for anyone under the age of 4, and it should not be taken past 7 days. The methods of administration, it comes in tablets, gel capsules, or liquid and syrup. It is also a main ingredient used to manufacture methamphetamine. Methamphetamine is administered or taken through inhalation, which is snorting, intravenously or smoked. Pseudoephedrine does not require a prescription, but the sales are monitored due to its involvement in methamphetamine manufacturing. An addict of pseudoephedrine, they will purchase large amounts of cold medicines. They often suffer from insomnia, isolation, mood swings, or poor performance. What are the risks? The risk of use is overdose, dependence, withdrawal, elevated heart rate. It is definitely not for use during pregnancy. The side effects can be urinary retention, insomnia, anxiety, dizziness, and excitability. Signs of withdrawals are being lethargic, irritability, depression, nightmares, increase in appetite and cravings. And the signs of overdose can be dilated pupils, hallucinations, hypertension, seizure, or skin reactions. How can we treat it? Methamphetamine, because it is a subject ingredient, I included this. They do 12-step programs, faith-based recovery programs, cognitive, behavioral, or inpatient and outpatient programs. Recent studies they've done have shown that music therapy and exercise can greatly benefit meth addicts. And then you have to address any co-occurring disorders, and relapse prevention is very important to prevent relapse. Pseudoephedrine, they do comprehensive assessments. There's evidence-based therapies. They do it in both group and individual sessions. Medication management, evidence-based prescriptions for as far as like co-occurring disorders to make sure there's no overlaps or negative interactions, and relapse prevention planning. Trauma-informed care programs that can treat these include Seeking Safety and the 7 Challenges program. There are other programs that can also be found. And why does it matter? So pseudoephedrine addiction is hard to detect. It's hard to detect. It affects a lot of adolescents. It has no individual DSM, so it can also be interlinked with side effects or from other addictions. Once you take pseudoephedrine, there is no going back. They do not have a treatment for specific treatment for pseudoephedrine addiction and overdoses. It is easily obtained. They do have restrictions on it because of its use in meth, but it does not require a prescription, and it can cause or exacerbate mental health issues. And then Here are all my resources and references that I found and where I gathered all this information from. Thank you.